हेलो एवरीवन। आज हम डिस्कस करेंगे अबाउट द डिजीजेस ऑफ नेज़ल वेस्टिब्यूल। सो नेज़ल वेस्टिब्यूल के डिजीजेस में आते हैं फरंकल या बॉयल, या इन्फ्लेमेशन ऑफ वेस्टिब्यूल लीडिंग टू वेस्टिब्यूलाइटिस, स्टेनोसिस या अट्रेजिया ऑफ नेयर्स एंड ट्यूमर्स। ट्यूमर्स में आते हैं न्यूरोवैस्कुलर सिस्ट, पैपिलोमा और वॉट एंड और स्क्वेमस सेल कार्सिनोमा. We'll discuss about furuncle and boil. So what is furuncle or boil? It is an acute inflammation of the hair follicles by Staphylococcus aureus. तो what is furuncle? Acute inflammation है किसका? Hair follicle का. क्योंकि हमें पता है वेस्टिब्यूल में क्या होते हैं? Vibrissae. What are vibrissae? These are the coarse hair, right? So जब ये hair follicle it gets infected by Staphylococcus, then it leads to the inflammation of this area leading to the furuncle. So what are the predisposing factor? मतलब कि किस वजह से ये जो स्टेफाइलोकोकस है it can cause the infection in furuncle. पहला तो picking of nose, ठीक. दूसरा plucking nasal vibrissae. When you pluck the nasal vibrissae, if your nose is not clean, then the staph, because staph aureus it can get inside and it can cause the infection of the hair follicle. So what will be the clinical features? ठीक. When you will see this furuncle, it will appear a very small structure, and when you will touch it will pain. So there will be a tenderness will be there. Sometime as a complication, even the nasal tip, like skin of the nasal tip and the dorsum, it can also become red and edematous because of infection. And fourth is कि this vestibule might get ruptured, right? Then let's फटाफट फिर से revise. So what is furuncle? It is acute inflammation of hair follicles in the vestibule. It is caused by what is the organism? The organism is Staphylococcus aureus, ठीक. So what will be the symptom? It will be small, tender. These are the main common symptoms. And if it's a complication, then what will happen? The infection may reach to the tip of the nose and the dorsum. So this nose, skin of this nose and tip of the nose and dorsum, what will happen? There will be inflammation. It will become red and edematous. Even the tender will be there. Take. What will be now? We'll discuss about the treatment. The treatment will be a warm compress. Take. Then analgesics, because there is a pain. So analgesic will help in relieving pain. Then topical and systemic antibiotics against staph aureus. Then incision and drainage. Incision and drainage, it's done only if there is any fluctuant area. Fluctuant means a furuncle has fully developed. Then only incision and drainage is advisable. But if there is a premature boil or premature furuncle, then incision and drainage it is not done. It is contraindicated, or furuncle should never be squeezed. This should be kept in mind, that this furuncle should never be squeezed and the premature furuncle should never be incised. The reason for this is, like for example, then if you squeeze, then the material from the furuncle will come out. It will cause the infection. The infection may reach to the veins of the nose, like angular vein or facial vein. Then from that angular and facial vein, it will cause venous thrombophlebitis. What is venous thrombophlebitis? It is the inflammation of the veins, right? Then these veins, we know that these veins are connected to the emissary veins, and these emissary veins are connected to the cavernous sinus. That is why this area of nose is called as a dangerous space, because any infection here can go to the brain. So it will lead cavernous sinus causes thrombosis. So now the complications. So what are the complications? I told earlier that when the nasal tip, skin of the nasal tip and dorsum can become infected. So if the skin then it will cause cellulitis, and when the dorsum is affected, it will cause septal abscess. Now we'll start with the next disease of the vestibule, that is vestibulitis. So vestibulitis. So what is vestibulitis? Itis means inflammation. So it is the diffuse dermatitis of nasal vestibule. Okay. So the causative organism is Staphylococcus aureus. So how does this vestibulitis occur? So for example, you can think as there is any pathology in the nose. There can be rhinitis, sinusitis, or nasal allergy. So the common thing in all these things are that there will be a nasal discharge. That nasal discharge is infectious. So a person tries to clean that nasal discharge using handkerchief. So repeated use of that handkerchief will cause a trauma. So the infection can get inside the vestibule through that trauma, leading to the infection and inflammation of vestibule. So the types of vestibulitis, we have acute and chronic. So the acute, when the acute case of vestibulitis comes, then how does it appear? It will be red, swollen, but the thing is that it won't be not tender. There will be no pain. If you touch that vestibule, then the person won't experience pain, and then crust and scales will be present on the area of the the scales will be present on the area of the skin erosion. Matlab ki see the person using that handkerchief and he will erode or excoriate that area through which infection will get. There will be crust and scales will be seen. This can be better visualized seeing a diagram. So the diagram is this. You can see this diagram, the first diagram. In this diagram you can see it is edematous. Look at this. This is normal, and in this part there is vestibulitis. See, it's swollen. It's red. You can see some excoriation. Crust and scales can be seen. So what is this? This is acute vestibulitis. Red, swollen, scales and crust can be seen. None. Now chronic vestibulitis. In case of chronic vestibulitis, there will be induration of the vestibule skin. So there will be some indurations, and there will be a painful fissures and crusting. Fissure, see, actually this is a picture of acute vestibulitis, but you can make out the fissure here. See, this is the fissure, right? I know this is acute vestibulitis, but in chronic cases, the fissure will appear like this. Okay. So now, fatafat फिर से we revise. What is vestibulitis? The diffuse dermatitis of nasal vestibule. What is the causative organism? It is Staphylococcus aureus. How does it happen? There will be nasal discharge. Nasal discharge will be because of any pathology like rhinitis or sinusitis, nasal allergy. Then you rub your nose. There will be erosion of the skin, and the organism will get inside, leading to the inflammation. Now it's acute and chronic. Acute, what will we see? We have seen the picture, right? It is red, swollen, crust will be there, or scales will be there on the eroded area. What about chronic? It's a chronic. We know chronic, there is a formation of granulomas and all. This you have learned in pathology. So there will be induration, and that will be painful fissures and crusting will be seen. Now let's come to the treatment point of view. See, how will you treat? When you are seeing the nose, you will see all the crust and scales. So now you have to first remove all this crust and scales. So how will you remove it? You will remove by using a hydrogen peroxide. The hydrogen peroxide by using a cotton applicator. So take H2O2 solution, then soak that cotton in that, and just remove that crust and scale with this. Then antibiotic steroid ointment. Why antibiotic steroid? Because it is caused because of the Staphylococcus aureus, and steroid because it's a chronic inflammation, so we have also reduce that inflammation, so we need antibiotic steroid ointment, and it should be used for some days. Actually, this condition is a very recurrent condition. It happens again and again, so that is why we have to use for some days even if we get an apparent cure. Second, as we have seen the fissures are how will you treat? By cauterization using the silver nitrate. Okay, then the first and most importantly and the last, you have to treat the cause because of which all this happened. And what was the cause? That was a nasal discharge. So we have to treat the pathology behind that nasal discharge. But first we have to remove that crusting and all, then treat that nasal discharge. Okay, now then again after this we will move on to the stenosis of atrasia of nares. Stenosis and atrasia of nares. So first let's know what the stenosis and atrasia means. Stenosis means that there was any opening or there was any tubular structure. Because of any pathology, there was abnormal narrowing. So stenosis of nares means there is abnormal narrowing of the nares. Okay? So what are the conditions which causes the stenosis? There can be accidental or surgical trauma, or you can say iatrogenic causes. There can be some destructive inflammatory lesion. It is caused by smallpox virus, or it can be done like iatrogenic. It is done in Young's operation. What we do, Young's operation is done in atrophic rhinitis. To protect it from drying and crusting, we close the nares. So in Young operation, we deliberately close the vestibule by using the nares by using the flaps. So the pathology behind it is, for all these will lead to injury, not Young operation. Accidental any infection, trauma, burns, all these will lead to the what they will cause? They will cause injury. This injury, then there will be healing process, and they will heal by the formation of fibrosis, and this will lead to the scar contracture, hence closing of the nares. How it is treated? It is treated by the reconstructive plastic procedure. The reconstruction is done of that nares. We open that the narrowing which is occurred because of the fibrosis. We just remove it and again open the nares. Atrasia. What is atrasia? For example, there should be an opening, but congenitally it failed to develop into any tubular structure. So in atrasia of nares, it is congenital. It will be better understood using these diagrams. I'm sorry, the diagrams are not so good, but I'll try to explain you. So these are the nasal placodes. So the nose, it develops from this nasal placode. Then is nasal placodes. There is a development of two process. This is the medial process, and this is the lateral process. Right. Then what happens is, this is the medial and this is the lateral process. Wait a minute. For example, this is the placode. From this placode, two process arises, medial and lateral. Still, the canalization has not occurred, right? So, in case of congenital atrasia, what happens is, there is the non-canalization of this epithelial plug. There is epithelial plug between the, this is the medial process. This is the lateral process, and between the there is a epithelial plug, and the nares developed after the non-canalization of these epithelial plug. So the congenital atresia occurs when there is non-canalization. Means this should be canalized and it should be formed like this, right? So these are the nasal nares, but this does not happen, leading to the congenital atresia. Now we will move on to the tumors. So tumors, we have neovascular cyst, papilloma or wart, and squamous cell carcinoma. First, let's discuss about this neovascular cyst. So the site of this neovascular cyst is the lateral wall of the vestibule and the floor of the vestibule, right? How will you treat it? You will just excise it by the sublabial approach. I'll show you the picture. Yeah. See, this is the cyst. One second. Let me do it better. Yes. See, you can see this structure. This is a sublabial cyst, right? And this is a sublabial approach, means below the lip. So by using this sublabial approach, we will excise this cyst. Okay. Then you have second is squamous cell carcinoma. The site of origin is the lateral wall of vestibule, and it may extend up to the nasal. Nasal floor, columella, upper lip. Okay. And as it is a carcinoma, it is a malignant tumor, so there will be metastasis. It will metastasize to the parotid and sublingual node. The treatment is same by the surgical treatment or by the radiotherapy. The third is papilloma or wart. They can be single or multiple, pedunculated or sessile, and they are also removed by the surgical incision under the local anesthesia. Now let's fatafat revise whatever we have done. So we have done the diseases of nasal vestibule. So now you also start, try to say with me, right? Don't see what it is here. So let's start. So what are the diseases of the vestibule? What are the diseases? First one, furuncle or boil. What is the second? Vestibulitis. Third, what we have done? What is the third one? Yes, it is the stenosis or atresia of the nasal nare. And what's the fourth? It's tumor. What are the different types of tumor? Four. We have neovascular cyst. What is the second? Papilloma. Third, what is third? Squamous cell carcinoma. Okay, done. What is furuncle or boil? Furuncle, it is the acute infection of hair follicle. What is the causative organism? Staphylococcus aureus. How does it happen? This etiology by the pricking of the nose or by plucking the vibrissae. What is vibrissae? It is a coarse hair. Done. Clinical feature. What is the clinical feature? It will be small, tender, sometimes nasal tip, dorsum becomes red. Treatment. How will you treat that furuncle? Cold compress. It is because of infection, so antibiotic, analgesic, topical incision and drainage. And what we have to keep it in mind in furuncle, that you should not squeeze it, pehla. And second, you should not do the IND, incision and drainage of the of premature furuncle. Why? It will cause cavernous sinus thrombosis, and I have told the pathology before, right? Then vestibulitis. What is vestibulitis? It is a diffuse dermatitis of nasal vestibule. Organism the same, the Staph aureus, predisposing nasal discharge, and the what others? Trauma by the handkerchief. It can be acute and chronic. I've shown the features and red, swollen, crust. How will you treat? You will remove the crust. It's a chronic, so you will give steroid and antibiotic ointment, right? Then stenosis. What? Stenosis and atresia. Stenosis can be because of accidental surgical, right? Or destructive inflammatory lesion. Young operation for atrophic rhinitis. Why does it happen? It happens because of scar contraction. And how will you treat? By reconstruction. Atresia, how does it develop? Nasal placode. Nasal placode gives two processes, medial and lateral. Between them, what it is there? Subepithelial pair, subepithelial plug. What happens? Non-canalization of subepithelial plug, means canalization does not happen, leading to atresia. Tumors, neovascular cyst, papilloma, wart, and squamous cell complex. These are not so much important. with respect to university exams, but rest two are very important, right? So neovascular cyst, papilloma, and squamous cell carcinoma. Okay, this squamous cell carcinoma, it metastasized to the parotid node, and what is the other node? Sublingual node. Okay, it's done. So I'm ending this video now. Thank you so much for patiently listening. And if you want some face-to-face videos of different anat and all, then you have to like, my subscribers should be more than, when it will be more than 1K, then I'll upload face-to-face this teaching lectures of some anatomy, like bones and all. Okay, thank you so much. Bye.